To continue Dr. Partho's introduction, he is a senior consultant in the Department of Uvea and Cataract at Shankar Nethralaya. He completed his fellowship from there as well. He is an avid researcher and is extremely interested in ophthalmic education. And he's, I think, the right person to talk to us on various resources, both electronic and non-electronic, available for students of ophthalmology.
Thanks, Deb, for a kind introduction. So, good afternoon, everyone. So, I think after the lunch and post-lunch session, so let's start with something very interesting. So, it's all about resource option for the training in ophthalmology. So, before I go into that, my presentation, which will be mainly, I'll be showing you various resources available mostly in the internet and electronic media. So before I go there, you have to remember that the most important or resourceful we have is our books, textbook. So you have to keep that in mind, and with that, we'll just start our presentation. So I'll start with a very important opportunities AIOS has given us, that is the access to the One Network. So this One Network is one of the brilliant resource an AIOS member can actually browse. So you have to write to the secretary and take the login, create the login ID, and then you will get the access. So what you have there, you can access lot of journals like ophthalmology, entire segment you can actually access. You can access the American Journal of Ophthalmology, Survey of Ophthalmology. So all this journal can be accessed through this One Network in journal sections. So next you come, I always, sometimes whenever I read something or after a certain period of time, I just test my knowledge with that. So all of you can actually go with that. There is a section called Test Your Knowledge. So it's a very interesting, it's like multiple choice based option. So you can select, there are a lot of options there like cataract, cornea, glaucoma, and you can take the test and again log out, and again you can log in. So it will show you the percentage of the question you have completed. So here is an example actually I have taken in uveitis. So there will be a case scenario and they will give you 4 options, and most interestingly there will be a discussion on it. So once you attempt that, you will be given a proper discussion and reasoning on that. So it will be helpful for you to update your knowledge. So the next important thing is that their guidelines. So if you go to that, you will have a lot of options like most importantly the PP, preferred practice pattern. So there are several monographs or the PDF files are available in that segment. So you can go through them. And there are certain some non-preferred practice pattern also, like current trend in the biosimilar in ophthalmology. So this kind of monographs are available in that section. So next is very important, very quick way to just browse, update your knowledge or just test your clinical. This thing is that diagnose this, where you will be given a photograph and there will be a case scenario, and same way you can take a test, and they will provide you with a lot of discussions, and even the references are there. Like you can browse the particular article if you have further query on this. Now, there is another website, those will be preparing, I think the subsequent speakers will be discussing that. So MRC Optha and all. So there is, I think, one of the best website we have, that where there are a lot of options for taking multiple choice questions, going through the OSCE, and little bit of various trials and the trivia in ophthalmic history. So it's a beautiful, I think you must visit this site and browse it with taking a test. It has even dedicated section for some commonly advised investigations in ophthalmology, and there are various snippets on the ophthalmic images and various interesting clinical information. So next, my favorite is that eye rounds. If you see in EOPTHA also, we try to replicate this kind of in Indian ophthalmology. So it is a very, very nice website by the University of Iowa. So you will see there are a lot of cases, atlas, and videos are available, and tutorials, and all free. You don't have to log in also. You can browse the website for free. So you must visit this website. The second one is very important for the same from the same institute. It's all about gonioscopy. So you'll have multiple videos, multiple presentations, multiple tips on how to perform or how to excel in gonioscopy. So you must visit this site gonioscopy.org. Now here is another, recently they have launched that stone rounds, and it deals with all iridomacular degeneration mainly, and you will see lot of clinical photograph, very rare iridomacular degenerations, retinal degenerations. You'll get the photograph, you will have the details discussion on this. You can't even ask a questions and they will come back you will give answer to those questions after a certain period of time. So this is another, and this is very important for all practicing ophthalmologists or the trainees, those who are interested in learning something. It's almost like a quick course, like online you take a photography course, you take. So it's the cyber site has a dedicated section like biomedical engineering. It has sections on even for the nursing. So if you are interested, you can refer your nursing staff also to take that. So it has a module kind of this in several subjects. So let me show the first module. The first module is on about, if you take the module of MICS, you can see that there are several modules there, and each module has a dedicated video. First they will ask you for pre-module assessment, where you will be given a list of MCQ, and once you go through all this video, like cataract basics, history taking in a patients with cataract, the screening of high risk patients in your setting, IOL calculation for cataract surgery, all dedicated videos are available. So once you finish this module, you will be provided with another set of questionnaire, and once you finish that, they will give you a certificate. So it's highly recommended for everyone. You can go ahead with take the test, and there are certain like other you can see here that non-surgical management, how you can approach a adult cataract. And there are like what are the difficult cases. There are snippets for quick revision, like what are the difficult for example, in this scenario you can see the deep set eyes, what are the possible problem and what are the potential action or strategies you should follow. Similarly, in Fuchs corneal endothelial dystrophy, what are the difficulties you can encounter. So all these are there in this modules of cyber side. This is another, if you have a long means you have to travel daily a long distance, you are stuck in traffic. So nowadays they are calling it as traffic university. That means every day you listen to something, some podcast or something while going to your work or coming back from your work. So I think this is one of the very important this thing, that retina podcast. This is the from the straight from the cutter's mouth. So there are dedicated, as you can see here, we are talking about that episode 388. So it's a brilliant concept. You all of you must, those who are a vitreoretinal surgeon or interested in vitreoretinal surgery, so you must actually visit this podcast and try to utilize it. Second one, for all the ophthalmologists, we have that Eyes for Ears. This is another again podcast. So if you are going for a walk or you're stuck in traffic, as I said, so this kind of podcasts are very interesting resource for you. So you can actually take a lot of modules are there. You can even take the modules for your learning, and you can go through some of them. This is another OCT cases, very good for the OCT if you want to learn about the OCT. So there are specific OCT pictures, and there will be dedicated discussion on OCT picture. Believe me, this is one of the most brilliant imaging based resource you can have in your mobile or in your laptop. So do browse this. So this is eOptha, which I created when I was a ophthalmology student in Silchar Medical College. So it has grown exponentially, like from all of you have contributed. So it has a lot of PowerPoints, fellowship information, a lot of articles by the senior ophthalmologists and teachers. So if you have not browsed it, please go through them. This is another by my junior friend. So he has started this iLearn, which has a lot of option for the resident. Like you have the question bank, you have dedicated interview on various fellowship in various institutes. So you must browse this. This is another by Dr. Santosh Honawar and Center for Sight. So this is a eye focus online. All of you know that it is available in YouTube, and also it comes as a Facebook Live. So you can browse the dedicated video. It has several subspecialty episodes, and where multiple episodes are there. So this is another must visit for all the ophthalmologists and ophthalmology students. Just coming back to my last topic, that searching that PubMed. So it has become very, if you see the PubMed's inherent search engine is not that powerful. Sometimes you will search certain keyword, it will be difficult to reach the proper article and all. So that's why one easy way of searching PubMed is that you go to Google, put that topic, just give a comma, and write the PubMed, and then you can search. That Google search engine is sometimes much more powerful than the PubMed search engine, inherent PubMed search engine. And this is one newly coming, that ChatGPT and AI based 1 minute. So AI-based module, which actually with the help of ChatGPT, they are developing. So my friend Dr. Jay Chablani is working on that. So where they have created a module where you have to give something like, for example, if you say write what is pink eye, they will define pink eye. They will define the conjunctivitis from a PubMed reference. So anything in ophthalmology you want to ask the definition, it will give you the PubMed reference for that. Second, if you ask that chatbot that how the conjunctivitis, how the scleritis is being treated, it will give you the complete algorithm based on the PubMed reference. So that's it. Thank you. I'll be happy to take any question you have.
Thank you, Partha. This is really very good as expected. There are a few more resources. So what he's saying is that internet is full of a lot of knowledge, but a lot of that knowledge is not filtered. And whatever he mentioned, or whatever website that you go through, should have a filtered knowledge. Now, some of the other sites which would be useful, especially for people who are going to write exams, the iWiki. Now, iWiki has very large number of articles on every specialty. Like in specialty like neuro-ophthalmology, they have 350 articles. And the good part about those articles are they are all being curated by faculty, and then there is an editorial board which reviews that article before it's published. So iWiki is a good source. A word about ChatGPT. ChatGPT slowly is becoming a little mature. In fact, you can give a case scenario, and around 60 to 70% of the time. So if you write in ChatGPT, a young female, acute loss of vision with pain, and the vision loss is poor, or whatever, they will come up with answer which is fairly accurate. Like ChatGPT will come up with optic neuritis as one of the main differentials. So it is becoming more and more mature. It's an AI-driven algorithm. More we use it, more mature it will become. So I wanted to talk about these two, iWiki and ChatGPT.
Great, thanks for that input. I welcome any questions for Dr. Partho from the audience. You know, we have a lot of resources. Maybe if I can ask Dr. Partho a little loaded question. How do you prioritize? I mean, now there's a plethora of information and websites and resources. Would you really be able to guide us to which are the ones which are probably better suited for certain topics, or should one really go through all of them so that one gets a flavor and then prioritize?
Yeah, I think it will be, it depends on few things, like what subspecialty you are browsing for. So there are some dedicated websites. For example, I showed that if you need to know about gonioscopy, so you can browse that. The best resource, if you ask me, the PubMed is the best resource because it has the evidence-based literature. So whatever you search, I suggest, for example, if you are searching for treatment of something like scleritis. So if you search the Google with that the treatment of scleritis, PubMed, then it will show the PubMed this thing. And another good way of searching literature or information is go to PubMed, search a topic, and just go through the freely available review article. So the best way to update your knowledge, because as Rashmin Gandhi sir has pointed out, there are a lot of information in the internet, and you have to be very careful when you are browsing them and taking something important for you to imply in your clinical practice. So I think the PubMed is the best this thing.
I'll probably add a little bit more. I mean, when you go to internet to search, basically there are two main streams. One is you want to know what you want to search, like you want to know about optic neuritis or you want to know about gonioscopy. And the second is where you encounter a topic or a patient where you don't know much about it. So these are the two. So there are specific websites which will give you a clear answer about what you are looking for. Like in neuro-ophthalmology, there is a website called Novel. Now that's a very, very rich resource where you have past 30 years North America, all neuroophthalmic conferences are available there, either in a document form or in a video form. Plus, there are articles which are available. The videos, I mean, neuro-ophthalmology is all about ocular motility, so a lot of videos on nystagmus which is available. So if you know what you're looking for, there are websites for that. If you don't know, let's say if you're stuck with a case, then ChatGPT, algorithm are the websites that you look for.
Thank you. We'll move on to our next